Report, a public affairs presentation of KTBW. The opinions expressed on this program do not necessarily reflect the views of the Trinity Broadcasting Network.
Welcome to Public Report. I'm Marcel Camille. On today's program, we'll take a look at women's health issues, two in particular, breast cancer and incontinence. Here to discuss these issues with us today are some of the staff from St. Francis Hospital. Please help me introduce
Cynthia Kannenberg, manager of the Women's Health and Breast Center at St. Francis.
Sherrie Samuel, patient care coordinator at St. Francis.
Kris Costello, physical therapy.
Please share with us a little bit about what you do there at the center.
Well, I manage the Women's Health and Breast Center, and we cover all sorts of diagnostics from breast care, ultrasounds for fetal surveys, bone density tests. We have chiropractic care and massage therapy and physical therapy from Kris. So we cover a full gamut of women's health issues.
And Sherrie, what do you do there?
I'm a patient care coordinator. I take a patient when they have an abnormal mammogram, ultrasound. I schedule their biopsies. I explain the process. I also, if they're positive, I also work with a breast surgeon. I schedule their surgeries, their oncology, radiation oncology care.
So from my understanding, you go from start to finish with the patient through the cancer
That's correct.
process. And Kris?
I am a physical therapist, and I treat women with pelvic floor muscle disorders, and that can be anything from incontinence or leakage, whether it be urinary or fecal, as well as pelvic pain issues that can accompany many gynecological and urological pain syndromes.
Okay, so we have professionals here to share with us concerning breast cancer issues as well as incontinence today. During the first portion of the show, we're going to take a close look at breast cancer, the challenges, problems, and solutions surrounding that issue. And we'll take the last 15 minutes to really focus on incontinence and pelvic floor issues, something that a lot of people aren't aware of unless it's affecting someone in their family. Let's just dive into breast cancer. Okay. What are you guys seeing here in the Northwest at St. Francis Hospital?
As far as types of cancer?
Yes.
Well, what we're finding is that in the Pacific Northwest, if you look at the demographics of the United States, approximately 28% out of every 100 women that have a mammogram will be called back for an additional view to examine a certain area of their breast tissue in greater detail. And out of those 28%, about 7%, again this is nationally, are then going to have some sort of biopsy or type of cancer diagnosed. In the Pacific Northwest, however, we're finding that there is a higher incidence of cancer, and one of the things that we are thinking that is related to is the lack of vitamin D in the Pacific Northwest. We just don't get as much sun as the rest of the country.
Okay. Yeah, that was a very interesting factor from the Cancer Society that I also ran across too. Sherrie, what are you seeing? Because you're dealing specifically with the patients.
Correct. With our new digital mammography, we have more callbacks. Patients are more concerned about getting called. They're not as concerned about having another mammogram as they are about, oh, they found cancer. But most of the time, it's just an additional view. The radiologist says everything is benign, everything's fine.
If I might add to that and explain a little bit about the digital mammography, in the past we've had analog film, which is sort of like the old age of film that we used to have in our cameras, where you'd send off the roll of film and get that developed. That was the technology that we've had for years and years and years, and it was very successful. Now we have digital mammography, and again, think of it as your new digital camera. What more you can see immediately with that digital camera. You can zoom in, move left and right. So what is happening is the radiologists are now armed with so much more information, and they can examine that breast tissue picture in very, very great detail. As you know, early detection is the key to capturing breast cancer early and solving that problem, and digital mammography gives us that tool. So a patient may be called back so that we can really look at one particular area of the breast tissue in greater detail. but it's all for her own best benefit.
Well, we've spent the first 15 minutes discussing breast cancer issues. Let's shift over and talk about incontinence. Well, it is an unfamiliar term with a lot of our viewers. Can you share with us, Kris, a little bit about incontinence and what that means?
Sure. Incontinence, first, we need to understand that it is not a normal process of aging. Incontinence just means leakage, whether it be urinary leakage or fecal leakage. And urinary leakage is something that's actually very, very common in our society, but it is not a normal process of aging, and women should not accept that. So understanding that incontinence is something that does occur, and there are a lot of things that can be done that does not involve drugs or surgery.
That's wonderful to hear. I understand that you brought something with you that can really give us a good picture of how the pelvic floor works and how one can become incontinent.
Well, first I would like to go over some anatomy of the pelvic floor, because a lot of women don't even know what a pelvic floor is. And just understand, it's the fascial and muscle layers that go from the pubic bone in front. They connect onto those bones that you sit on, and then they come back and attach onto the tailbone and sacrum in the back. So these muscles act as a hammock that go from the front to the back, and they support the pelvic organs above them. And you have the outlets being the urethra, the vagina, and the rectum going through them. And these muscles really have some pretty darn important functions to fill.
Okay. What functions, does the pelvic floor handle?
I like to call them the 4 S's.
Okay.
So the first S is the support function. It supports all the organs above it. It helps hold the bladder, the rectum, and the vagina up.
Very important.
Very important. Second function is its sphincteric function, or the faucets. So they're the faucets to the urethra and the rectum. They keep them closed until you are good and ready to eliminate.
Okay.
Third function is its sexual function. So it gives a sexual appreciation. And its fourth function is its stability, meaning it is the bottom of your trunk. So when you do anything that creates intra-abdominal pressure, such as coughing, laughing, sneezing, exercise, lifting something heavy, that intra-abdominal pressure presses down on the floor, because pressure goes in the area of least resistance, and that's going to be down. So those muscles act as a support and stabilization function for the trunk. You've heard of core strengthening, and core strengthening is the pelvic floor as well as the abdominal wall and the back. It is your pelvic girdle. Right.
If someone or one of our viewers is having slight incontinence problems, what would you recommend? Because it sounds like there's a lot of hope.
There is.
You can reverse this. That's what it sounds like.
You really can. You really can. There's a lot you can do when you have it, and there's a lot you can do to actually prevent it. So talk to your physician. Talk to a physical therapist that is well versed in pelvic floor muscle rehabilitation, and get some exercises, get some education. There are a lot of things you can do.
Which is wonderful. Cynthia, we spoke a lot about breast cancer at the top of the show. What do you feel is really important for our viewers to take away from that section?
Well, there's a couple of things. One is, of course, early detection is the key. So you do want to do your monthly breast self-exams. You want to make sure you get a clinical breast exam every year. And when you reach that age, have your mammogram. And where possible, really look for digital mammography. Beyond just the physical aspects of that, though, at St. Francis and the Women's Health and Breast Center, we really stress mind, body, spirit. And we don't want to just treat the physical condition of the woman. And this is what's important, like what Kris is talking about. The kinds of things she's doing is not just treating the physical condition, but giving a woman a sense of freedom and confidence. And we're treating that spirit and treating the quality of life. Sherrie, in her role as the angel at the Women's Health and Breast Center, of guiding women through their plan of care and helping them above and beyond just the physical nature of their illness, is a huge part of what we do. So we really pride ourselves on treating not just the body, but the mind and the spirit, and making a more complete partnership with that patient.
Wonderful. And Kris, you shared a lot about the pelvic floor and incontinence. What do you feel is really extremely important for us to remember?
Remember that you do not have to live with incontinence. There are many things you can do. and they are actually fairly easy to do as long as you're able and willing to follow an exercise program that really is not that much difficult or very difficult to do at all.
Wonderful. Are there any last-minute things you'd like to share with our viewers concerning breast cancer?
I'd like to remind women that breast cancer isn't the death sentence that it used to be, that we have so many alternatives, and they can get in with a good provider. Another thing is when they do go for their visits, whether it's the surgeon, the oncologist, bring an extra set of ears, because you don't hear maybe even a third of what the provider's telling you.
Pretty much in a state of shock, probably.
Exactly. You need someone else that can hear things and ask questions with you.
Okay. Well, we really appreciate the information that you shared with our viewers today. We have St. Francis staff here. I'm Marcel, and I thank you very much for viewing. This was your Public Report. Bye-bye.
You've been watching Public Report, a public affairs presentation of KTBW. The opinions expressed in this program do not necessarily reflect the views of the Trinity Broadcasting Network.